Hi, my name's Tommy. I'm a volunteer firefighter at EMT at the Winfield Community Volunteer Fire Department in Sykesville, Maryland. I also happen to be an Eagle Scout. Over the next little bit, you're going to see several clips, videos, instructions, PowerPoints, and some other literature to help you guys work through the First Responder Adventure Book. Have fun and be safe.
All right, hi everyone, my name is Chris. I am the EMS captain currently here at Winfield Volunteer Fire Department. I have been with the department for 9 years now. 8 of those years I've been an EMS provider. The first 6 I was an EMT and coming up on my second year as a paramedic. And during all the 8 years I've been a certified firefighter as well. If you ever witness an accident, if maybe a motor vehicle collision, someone that trips and falls, the first thing you should always do is go and check on the person that is injured. Always see what their current emergency is and how severe the injury is. From that point, you should alert an adult or immediately call 911 for help. So first aid is the basic skill set that any person should always know how to have and have with them at any time for any emergency that may arise. If you happen to come across someone that has serious bleeding, the first thing you should immediately do, as I said before, is come and check them. See what their responsiveness is, see what happened, and then immediately try to begin to control the bleeding by placing your hand and pressure directly over the wound. As soon as you can do that, immediately alert an adult or call 911. If you happen to witness someone that's having a cardiac emergency or suddenly goes unresponsive and goes into cardiac arrest, the first thing you should do is go to their side, call their name, shake them, use anything that you can to see if they will awaken for you. If they don't, you should immediately check to see if they have a pulse. Checking for a pulse is simply taking your 2 fingers, you apply it on the side of the person's neck, just to the side of their trachea, and you're going to feel for a pulse. A pulse feels like a small little train going through. It's a pulp, poop, poop, poop. If you don't feel that, you should immediately begin CPR and call 911, and if available, notify an adult to assist you. If you happen to call 911 and there's no one else around, the 911 dispatcher will assist you with CPR instructions until 911 help arrives. If you come across someone who has stopped breathing suddenly for an unknown reason, as stated before, simply go up to them, call their name, see if you can awaken them. If they cannot awaken, immediately check for a pulse. As stated before, you'll take your 2 fingers, apply to the side of their neck, check for a pulse. If they don't, call 911 immediately, and they will give you further instructions on what to do if the person is not breathing. If you find someone that's having a stroke, immediately check to see their responsiveness and what their exact complaints are. The signs and symptoms that you're looking for someone that is having a stroke are the following. You will notice sometimes a facial droop to where one side of their face will be drooped lower. You can also notice a arm drift, so if they're unable to lift their arm or if their arm falls. The last one is their speech. If they're unable to speak clearly or garbled or unable to speak at all, those are all signs and symptoms of a stroke, and you should immediately call 911 as this is one of the most time-sensitive emergencies in 911 service. If you come across someone who is suffering a poisoning, again, first check with them, stay with them, do not leave them for any reason, unless it is to get help or to call 911. Once you call 911, they will give you more instructions for what to do. However, during the meantime, you want to have the patient sit down, stay rested, keep them ensured that everything is okay. If available, a second person should call poison control and obtain additional medical direction. As paramedics and EMTs, we will ultimately contact poison control after we arrive for additional instructions. So if you happen not to be able to do that, do not worry. If you come upon someone who's choking, there are 3 different types of choking scenarios that we typically see. The first choking scenario is what we call a mild choking episode. It's where the person is still able to talk and there is probably some coughing going on. For that, you simply want to encourage the patient to continue to cough and attempt to get the airway cleared. If you cannot get the airway cleared, immediately call 911 and they will give you further instructions. For the second type of choking, you will typically see the universal choking symbol, which is when the patient will take both of their hands and place them around their neck. This is known across the entire world as the universal choking sign. If that person is displaying that, they will require the Heimlich maneuver. The Heimlich maneuver is a simple yet life-saving maneuver that can be used. The last type of choking is when someone goes unresponsive and they are no longer breathing and cardiac arrest is imminent. At that point, you would want to start CPR. If someone goes unresponsive who is choking, never stick your fingers in their mouth unless you can visibly see the item or object that they are choking on. The last segment that we will be talking about is shock. Shock is a common emergency that people experience when a medical emergency occurs. There are numerous different types of shock. Shock can be an issue with the amount of blood volume in your body caused by bleeding. Shock can also be from cardiac issues, and there are numerous other types of shock. The easiest thing and most important thing to remember about shock is keep the person calm, cool, and collected. Have them sit down and immediately alert medical professionals if you believe that someone is experiencing shock. Shock typically is present in many medical emergencies. Some signs and symptoms of shock are cool, clammy, and pale skin. Those are not the only signs that you will see during shock. With many different types of shock, there are different signs and symptoms of it. Over the last few minutes, we've talked about numerous medical emergencies that you may encounter as a basic first aid provider. Always remember to keep the patient calm, reassure them that help is on the way. Always alert a grown-up or an adult and call 911 for any emergency that cannot be managed by you or the adult at location. Later in this video, you will see several demonstrations and explanations of several basic first aid skills.
Hi, my name's Dan, and this is Lee. We're here to talk to you about how to treat small cuts and abrasions. When you have a cut, let's say I have a cut here on my finger, and you have a buddy, your buddy can help you to dress your wound. So the first thing you're going to do when you have your buddy treat your wound is for him or her to protect themselves. So Lee's going to place rubber gloves on his hands to make sure that he doesn't get any of my blood onto his skin. So for a small wound on a finger, you always want to check the wound just to make sure that it's not very deep. If it's really deep, you're probably going to need to go to the hospital to get stitches. But if it's just a small cut, your buddy can help you out and dress the wound. So the first thing you want to do is clean the wound. In this case, we have an alcohol strip. Alcohol will kill any of the germs on the skin around the wound.
Very delicate touches, but yet hard enough to make sure it gets clean.
Properly dispose of the alcohol strip. And then the next thing, he's going to take out an appropriately sized Band-Aid. He's going to place the pad directly over the wound. And he wraps the adhesive strips around so that they're secure. He doesn't place it on very tight because we don't want to cut off any circulation to the finger. We're going to watch this wound now to make sure that the bleeding is stopped. If the bleeding soaks through the pad or begins to ooze out from underneath of the bandage, an additional bandage may need to be applied. For our next wound, we have a slightly larger wound on my forearm. In this case, a Band-Aid or a bandage such as this is not appropriate for that wound. So we need to use a different technique. So again, Lee's going to clean the wound first.
I like to clean the whole surface around just to make sure everything was done thoroughly.
In this case, we're going to use a gauze pad. This is a 2-inch by 2-inch gauze pad. Some gauze pads come much bigger. He's going to place it directly over the wound, And he can ask me if I want to. I can help him out in this case to hold the bandage in place while he applies tape to the bandage.
I try to pull some out ahead of time. That way I don't pull too tight on his skin.
Again, he is not placing a lot of pressure or squeezing my arm with the tape. It's loose, but it's secure. As with the Band-Aid on my finger, we're going to observe this bandage as well to make sure that it doesn't get soaked with blood or start leaking. Additionally, when you wrap tape around a limb, you want to look at the fingers to make sure that they're not becoming blue. If they become blue or numb, that means that the wrapping is too tight and it needs to be adjusted. That's all we have for how to dress a wound. So like we talked about, you have to clean your wound to make sure that dirt is out of it so that you don't get an infection. The best way to do it is to use the sink and soap and water. And it's really no different than how you wash your hands to protect yourself from germs, getting a cold or the flu or COVID-19. You want to wash your hands really well with soap and water. When you bleed, bleeding is actually part of your body's mechanism for cleaning out the wound. But sometimes we need to give our bodies a little bit of help with that. So what you want to do is use warm water and you want to use soap. It doesn't have to be antibacterial or anything like that. Any plain old soap will work. You take some soap, and if you have a cut finger, you just want to scrub all the dirt around it. It may bleed a little bit. You may see some blood running out of the wound as you gently scrub it under the water, and it might hurt a little bit when you do this. But understand, keeping it from getting infected is the most important part. Once you have washed off your wound, you want to gently take a clean paper towel and dab it to dry it off before you apply a bandage to your wound. And that's how you clean your wound using a sink. Hi, I'm Dan.
I'm Lee.
We're here to talk to you about how to treat burns. Now there are three basic types of burns. First degree burn is it's a surface burn. It doesn't go very deep into the skin, and usually it's very red and painful only. Second degree burn is what we call a partial thickness burn. That means that several layers of your skin have been affected by the heat. Typically you see a red, painful area with blisters. When you have that situation, please do not pop the blisters. The blisters are your body's protection for the skin from the wound. Third degree burn is what we call a full thickness burn. A full thickness burn means that all the layers of your skin have now been affected by the heat. Typically you can see black charred areas, and if you get a third degree burn in an area that's underneath of clothing, oftentimes you will have pieces of burned clothes stuck to the skin. Do not attempt to remove the clothing from the wound. What you want to do if you have a situation where you have a third degree burn, you would want to take a pair of scissors and cut the clothing around the wound. That way you're not destroying any more of the flesh, and when you get to the emergency room or to the burn unit at the hospital, the doctors can remove that over time. So today we're going to talk about how to treat a first degree burn, which is your most typical burn. If you're helping mom or dad in the kitchen and you accidentally touch something hot, a lot of times you'll get a first degree burn. When you have a first degree burn, let's say on the palm of your hand, it will be a big red area. We're going to go in and show you how to cool that area off using water in a minute. But once you have cooled the area under cold water, you run it under cold water for a few minutes, cool the skin down. A lot of time that's all you need to do in order to treat the wound. If, however, you do develop some second degree burn symptoms like blisters, or the wound becomes open in some way, you're going to want to put a dressing over that wound. So Lee's going to demonstrate how to put a dressing on the palm of my hand. And as a reminder, when you are helping somebody else, you want to make sure that you're protected from getting any of their bodily fluids onto you. So this is what's called a 3x3 gauze pad. It doesn't really matter the size. You just want to make sure that you put a pad larger than the size of the area of your burn.
That spot looks good. We're
All right.
up here.
There we go. I've burned my forearm. When you apply this kind of dressing,
Make sure I do it very loose.
yes, you do not want to mash this down or put pressure on top of the burn area. The whole purpose of this dressing is to prevent dirt from getting into the wound and causing an infection as you're going through the healing process. Once it's been dressed, you want to change the dressing frequently. Don't just leave this on there for more than a few hours. You want to change it and then continue to monitor your wound. If it's getting worse, if it's not healing properly, or if it's blistering more, you may want to talk to mom and dad about going to the emergency room or urgent care to have your wound looked at by a professional.
It's like Mr. Dan said, don't be afraid to take your gauze off every now and then, because the oxygen will actually help dry and air out your burn to help it heal. Otherwise, it'll just stay mushy, wet, and nasty. Nobody likes that.
All right, well, thanks for watching. We really do appreciate it, and stay safe out there. So now we're in the kitchen. That's where a lot of burns can happen, right? So if mom or dad are cooking, or you're cooking on the stove and you accidentally touch a hot pan and you burn yourself, the best thing for you to do is to quickly run it under some cool water. You want to make sure that you come to your sink, place it on cold, and hold the affected area under the running water for a minute or longer, maybe a minute or two. What that does is it prevents the burn from affecting your tissue. It cools down the burned area so that it doesn't continue to damage more tissue. Once you've done that, you want to gently dab it with a clean paper towel to dry it off. If it's a first-degree burn, you probably don't need to do any more treatment of it. If it's a second-degree burn where you have blisters, remember, don't pop your blisters, and you may want to lightly or loosely bandage that area to keep it clean, because we don't want it to get infected. A third-degree burn, you definitely need to go to the hospital and get medical treatment. Hi, I'm Dan,
I'm Lee.
and we're going to talk to you about a particular type of burn, sunburn. What kind of burn is a sunburn?
A first-degree burn.
That's right, it's a first-degree burn. Now, you can get some blistering with a sunburn, which is like a second-degree burn, but for the most part, all sunburns really fall into the category of first-degree burns. Now, the best way to treat a sunburn is just to not get one. So, when you're outside, you need to take precautions. Wear a hat with a nice brim on it. A sombrero would be perfect. You got lots of coverage. So big brims are great to protect you from sun. When you go outside, you probably want to wear sunscreen. Sunscreen comes in all different types. So you need to understand what kind of skin you have and whether you burn easily or not. There's something called SPF. It's the sun protective value of the sunscreen. The higher the number, the more protection you have. The problem with sunscreen is it does wear off over time, especially when you're out and you're sweating and you're active. Like Lee, he's out and sweating and active all the time. He probably has to put this on how many times a day?
4 or 5.
Easily.
Or if you're at the beach and you go swimming, if you don't get a more waterproof sunscreen, or it still doesn't hurt to reapply.
That's right. One thing that people forget about is your lips. Your lips can get sunburned. Putting lip balm on with an SPF rating is a good thing. This has got an SPF rating of 4. It's not a great amount of protection, but it is good enough for your lips. So make sure you take care of those as well, because sunburned lips, they're no fun.
And even if you are staying covered up and you are wearing a hat, unless you have a big sombrero, never forget the back of your neck.
Clothing is oftentimes a really good way to protect you. But sometimes your clothing does not have a very high SPF rating, especially if it's kind of sheer or t-shirt like material. So just be aware that you can still get a sunburn even though you're wearing clothes. But wearing a bandana around your neck or other areas where you want to protect yourself is a really good idea. If you do get a sunburn, you want to make sure that you take good care of it. You want to take a nice shower. You don't want to get too hot. And make sure you wash your body off really well. And then you want to apply aloe or some kind of after sun. You do not want to apply anything like oil or creams to your sunburn because that can actually make it worse or feel worse anyway. So that's what we have for sunburn. Got anything else?
No, just to reiterate on that though, like Mr. Dan said, if you use the wrong kind of lotion or even certain types of soap, you can cause a chemical reaction with your burnt skin and it will make it burn twice as bad.
Yep.
That is a lesson you learned once.
So take care and be safe. Lee has a blister on his big toe because he's been working hard and creating lots of friction inside of his work boots. When we have something on a blister on our foot, we want to be able to make sure that we are taking care of it while we're still able to move around and do everything we need to do every day. One product that we use is called moleskin. You can get it at the pharmacy or any place that sells first aid supplies. And what it is a pad. It's not made of the skin of actual moles. It's a synthetic pad, but it's pretty thick and it's got an adhesive back. So it comes in a big sheet because we never know how big or small of a problem we're going to have of a blister. So it allows us to cut it to size. What you'll want to do is cut off a piece of moleskin that will more than cover the blister. And the best way to use it is to cut out the area that is the size of the blister, such as that, and then you peel the back off and place it around and not over the blister. This allows the blister to fill in that hole and it provides a cushion when he walks. So it won't necessarily cause the blister to pop. Now, like we said, if the blister does pop, that's fine. You treat it like a wound. You want to clean the area with soap and water or with an alcohol pad in order to prevent an infection. And if you need to, at that time, you can dress it with an appropriate bandage. So that's what we have for blisters. Thanks for providing a good training aid, and you guys be safe out there. Hi, I'm Dan.
I'm Lee.
And we're going to talk to you about all kinds of nasty things like tick bites, insect stings, and snake bites. So let's start with ticks. Now, fortunately, neither Lee or I have a tick on us right now that we can demonstrate this. But we're going to talk you through it and we're going to show you the tools of the trade for how to properly remove a tick. Lee, what happens when a tick bites you?
They latch on and they're very hard to get off if not done properly.
So when you see a tick on you, if it's crawling around, that's easy, right? We just take the tick away and that's not a problem. But if you have one that's actually bitten into you, you're going to know it because one, it's not moving, and two, if you move it, if you actually touch it, it stays in place, and the backside of its body may flap up and down a little bit. Okay, that means the tick has already embedded itself in your skin. The way you don't want to do it is to take your fingers and try to pull it out. You want to get a pair of tweezers, such as these, and you want to gently use the tweezers, bring them up underneath of the tick's body, up to the head, where it's embedded in your skin. Gently pinch the top of the head and pull back out in the direction of the body. That way, one, you're not squeezing the tick, which could actually cause it to have its juices squeezed into your skin, which could cause you to have an infection. And two, you don't want to sever the head from the tick's body and leave it in your skin, because that can also cause you to have an infection. We don't want to have anything in our bodies that could cause us to have an infection, because that can be far worse than the actual tick bite. So Lee, you ever been stung by a bee?
Absolutely.
So how does it feel when you get stung by a bee?
Very sharp burning pain, instant panic, run away, right?
Yes. So sometimes when the bee stings you, some bees, their stinger actually stays in your skin. It's got little barbs on it, and it actually pulls part of the bee out. The bee will die when that happens, but it stung you and it's left a piece of its stinger in it. What it's doing is the venom sac on the stinger is actually going to continue to pump venom into your body through the stinger. That's really, really painful. So if you get that type of bee sting, you want to basically do the same thing that you did with removing the tick. You want to get a pair of tweezers, or you can use your finger, but tweezers are better. Go underneath of the stinger and just pull it straight out. You want to get that poison stopped. You don't want any more in your body. Because what's the most important thing that we have to worry about with certain stings and people? What is it?
Allergic reactions.
Right. Some people are very, very, very allergic to bees and the venom that they use. And it can cause them to have serious respiratory problems, which means they have trouble breathing. If that happens, if you see them begin to panic, if you see them begin to struggle breathing, if their body starts to swell, that is a serious emergency, and that person needs to be taken to a hospital right away. If they have what's called an EpiPen, then they should know how to use it. They may or may not be able to instruct you how to use it, but you need to get them help right away. It is very, very important that people who are allergic to venoms, bee sting venoms especially, are taken care of right away. And even if they have it under control, if they've used their EpiPen, they still need to go to the hospital.
If you do not have a pair of tweezers handy, you can either try to get a credit card from your mom or dad, or their driver's license, or go to your Pokemon card collection. You need some kind of sharp edge that you can run over top of where the bee sting area is, and that'll do the same principle as the tweezers. It'll, in essence, shave the stinger off of you.
And the last thing we're going to talk to you about is venomous snake bites. You ever been bitten by a snake?
No, sir.